Welcome back. You're watching CNN. I'm Brooke Baldwin. Today, a milestone in the push for Medicare for All as House Democrats held their first formal hearing on this very issue today. The bill, which was introduced earlier this year, would roll out a single-payer system over 2 years. And the topic has divided a number of Democrats, as some prefer to shore up Obamacare instead. And so with me now from Capitol Hill, Senator Bernie Sanders. He recently unveiled an updated version of his own Medicare for All plan, one that has received support from several of his rivals for the 2020 Democratic presidential nomination. So, Senator Sanders, welcome back. Nice to see you, sir.
Good to be with you, Brooke.
So first, can you just tell me why upending the entire U.S. healthcare system all at once is better than doing it incrementally?
Well, we're not quite doing that. What we're doing is expanding Medicare, which is a very popular program for seniors right now, 65 or older, over a 4-year period to all Americans. So in the first year, it would go down to 55, next year 45, and then 35, and then cover all Americans. Also, what we do is expand Medicare coverage for elderly people by including dental care, which is a serious problem today, hearing aids and eyeglasses. Those are some of the benefits that Medicare today doesn't cover. To answer your question as to why, well, the answer is that we today are the only major country on earth not to guarantee health care to all people as a right. You got 30 million people, 34 million without any health insurance, even more are underinsured with high deductibles and co-payments. And guess what, Brooke? At the end of all of that, we are spending twice as much per capita on health care as do the people of any other country. The question is not...
If I can jump in, that your 34 million point, but because so you're willing to extend health insurance to roughly 30 million who currently don't have it, while upending employer-based insurance for more than 100 million.
Well,
I see you wagging your hand, but
Yes.
but Senator Sanders, those are the hard facts. Those are the numbers. Why would you want to do that?
I'll tell you why. First of all, let's be clear. I know this is a talking point from our opponents, and let's understand the function of the current health care system, Brooke, is to make enormous profits for the insurance companies and the drug companies. Last year, the top 10 drug companies, for example, made $69 billion in profit, while 1 out of 5 Americans cannot afford the cost of prescription drugs when their doctors prescribe medicine to them. That's insane. So what we are going to do is lower the cost of prescription drugs in half. We're going to cut the cost of prescription drugs in half because that's what the rest of the world is paying. But to answer your question, let's be clear. Every single year, tens of millions of Americans change their health insurance program. If you get fired tomorrow, guess what? You're going to have to find a new insurance program. And that's what employers do. People quit their jobs every year. Tens of millions.
Right, but let's hope most of us aren't getting fired and we get to keep our insurance as long as heavenly possible. And in that case, a lot of people like to have that option. I'm just saying.
Yeah, you have, but you have that option. Actually, you don't. It's your employer who determines who your insurance company will be. What we are doing, the truth is that Medicare today is the most popular health insurance program in the country. And all we are doing is expanding it to cover all people. And when we do that, we do something that many private insurance policies don't allow. We give you freedom of choice as to the doctor that you go. Right now, if you're in a network, you may not be able to go to the doctor you want, or else you have to pay a lot more. No deductibles, no co-payments. And we provide much more extensive benefits than most insurance companies. So the question that you have to ask, or the answer, or the insurance company is, we are spending twice as much per capita on healthcare as the people of any other country.
On your point,
our life expectancy
I hear you on that point,
down.
Senator.
Yeah.
But on the point of price, because this really does come down to how you pay for it, how you pass this politically. And on the price tag point, how can you contain healthcare costs when care will be free, which would likely lead to a spike in how many are already using it?
It's not necessarily the case in other countries. What it will do, let's be fair, when we cut the cost of health care significantly, because right now we're not going to see, under our plan, $20 billion in profits going to 5 insurance companies, so $69 billion in profits going to 10 pharmaceutical industries, companies. When you do that and you eliminate all of the bureaucracy that currently exists, all of the administrative nightmares. I'm sure you have been to a doctor. I have been to a doctor. You got to fill out 1 million forms. We are spending a fortune just billing people in this country. The reason that other countries could do it much more cost effectively is their systems are simple. You walk in and you're covered. So the issue is, how do you pay for it? And that's a good question. Right now, you're paying for it in co-payments, in deductibles. Your employer is paying for it in a very significant amount. If you are a family of four right now who are self-employed, you're spending $28,000 a year for insurance. So what we are going to do is do away with private premiums. You're not going to have to pay premiums to a private insurance companies. We're cutting your prescription drug cost in half. Are your taxes going to go up? Yeah, they will, but not as much as your premiums are going down. The overwhelming majority of Americans will pay less for health